Guys, welcome back to Medical Coding with Blue. Today's episode is all about why new medical coders should work on site versus remotely in the beginning. If you're brand new to my channel, welcome. I am Blue, I'm a medical coder. Okay guys, so I'm getting this question a lot again from new medical coders that want to get into the industry and work remotely immediately. So I did get a message from a viewer and I'm going to address it here in a minute, but I want to do some housekeeping first. So first things first. I am not going to argue with anyone when it comes to this very topic. I am simply giving you my advice as a veteran coder of 15 years who has worked remotely twice for two different organizations. And I want to say this as well. There's a lot of things that are said in the schools, and sometimes they're said out in Facebook, and all these other people are saying things. These people sometimes don't have any experience as a medical coder. They don't know what it is like. Things are different when you are working at home versus being at a facility when you first start. Now, yes, there are going to be some areas where it is going to be needed, like in the East Coast, there's a lot of that, where there's not a lot of room at the facility, so they have their workers working remotely. But a lot of times what happens is they have them come in for training for like 3 months, and then they send them home. Now, if that's the case for you, that's great, because at least this way you get that hands-on training, okay? You get that hands-on training, you get that camaraderie around you, which I'm gonna go into in a minute. But as I said, I'm not going to argue back and forth with anybody, especially people who are brand new and don't really understand the industry yet, okay? I'm giving you my advice because I want people to be set up for success. That's what I want. I don't want people to be taken advantage of. And there's a lot of that. And when you think about it, there's a lot of these organizations like these schools and stuff like that want to sell these programs of medical coding to people, and they take advantage of any and every way that they can. Oh, you want to stay at home and raise your kids? Medical coding is right for you. Or, oh, you want to just get up and work whenever you want to? Medical coding is right for you. Wrong, okay? I'm going to say that flat out wrong, all right? But that's just my advice anyway, and that's my opinion. So again, this is my opinion. If your opinion differs from me, that's totally fine. You can go along your merry way, because again, I'm not going to argue with anybody who is going to say anything different, okay? I want to reach people who are here to seek out why they should work on site versus remotely in the beginning, because they want to know why. That's who my message is for today. But this message came in today, and I'm going to use this. I'm going to use part of it because it was quite a long message. So I'm going to get right to the point, and we're going to address this right now. So here we go. The viewer says, I'm looking to go to school for coding and want to get the best education in order to be considered for a remote coding job to work from home. Do I honestly need to change my jobs and stop doing what I love at the moment to go to work at a local hospital and just to get the experience that may be required of working in a department that deals with insurance claims / coding? Will this have to happen in order to be considered a good candidate for a remote coding job? I am trying to avoid it if at all possible, because I want to continue to work where I am until I get my coding certification. If I can get a remote coding position after my certification, then that would be good, as I would already be working remotely when the time comes for me to relocate. Again, this was a very long email, so I'm not going to go into her specifics. But here's the thing, guys. When it comes to people who have experience working in a hospital, or they're working in billing and now they're going to be a coder. And the thing is, when they're looking at candidates who are viable for these remote coding positions, they want people who have experience, right? Everybody says that they want experience. Even when you work at a place, they still want you to have experience. Because why? Employers are inherently lazy. They want people to come in, be plopped in, and know exactly what to do. Well, when you're brand new to the industry, that's impossible. And if happy coders are in the area, no one who has experience is going to be applying for these positions, so they have to look at the new candidates that come in and apply. So here's how you make yourself look good, okay? Because it's not about your experience before, it's not about all of these things, it's about you being open enough to say, okay, well, I may have to go in for a little while. And first of all, no, you don't have to quit where you are. I mean, obviously when you are in school and things like that and you're still working, that's totally fine. You can do that, because I did that. I continued to work until I found a job in coding, and it was quite a while. It was 2 months that I was looking. So, but here's the thing, guys, stay with your job, whatever you want to do, but as long as you have money coming in until you find your coding job, then you're okay. But here's the thing, when you are trying to get that experience and things, and you say, well, no one wants to hire me because I don't have experience and I want to work remotely, what they're looking at when you are applying is they're looking at somebody who has a fantastic resume, and it begins with a resume. And a lot of you don't want to hear that part. But here's the thing. Why is it important? Because this is the first thing that an employer is seeing of you. That's number one. All right. So whether this is an on-site position or a remote position, this is the first thing that they see. And what happens is a lot of times, a lot of you don't write very well on your resumes, because I've seen a lot of them on LinkedIn, 3 or 4 or 5 pages, and people are encouraging these people. Oh yeah, that's a great resume. It's a terrible resume. You know why? Because a lot of these employers don't have time to be shifting through a lot of these papers. It needs to be 1 page, the max 2 pages. It only needs to go up to 10 years of your work history, 10 to 15 years back. Okay, that's all you need, because this is just a snapshot of who you are. Now, I've said this many times. A lot of people don't put on there the appropriate skills. And the skills does not need to be 20 or 25 skills. I've seen that too. And I'm like, what are y'all doing? And some of these are repeated, okay? I don't want to see, if I'm a hiring manager, I do not want to see team player, organized, on time, I answer phone calls. Am I looking for a telephone clerk? No, I'm not. I'm looking for a coder. So if you have any of those 4 on there, get those off, because that's a waste of time. They need to know what your hard skills are. ICD-10 CM, and do not put ICD-10/CM/PCS. Don't do that, because that's lazy, and even I would reject you, okay? Immediately. CPT, HCPCS, medical terminology, anatomy, pathophysiology, all of those, they all need to be there, because those are what is on the job listings. So you have to make sure that that's what you have on your resume. Again, 1, no more than 2 pages. And so those candidates who appropriately identify themselves on their resume, because a lot of you don't put your credentials next to your name. Those are your credentials. It doesn't matter if you have a CPCA or a CPC or a CCA or a CCS. You need to have it on your name. If that is the credential that you hold, you need to have it on your name. All right. I see a lot of people out there with their name, no credential. Okay. Again, I would go right to the next candidate, because again, you don't know how you're supposed to address yourself, how you're supposed to present yourself. That's a little wary to me. I'm just saying. So the thing about it is, you're going to be able to capture their attention, and you can be available for those remote positions. But as I said, and the reason I'm going to keep saying this is because a lot of you are like, you have your heart set on working remotely. Oh, I can't because my kids, and I want to raise them, and I want to do this. Guys, when you're working remotely, you have to pay attention to what you're doing, because the productivity standards are going to be a little bit higher, because you are at home, and they're expecting you not to be distracted when you are at home working. Now, there are some organizations that they will watch how you move the mouse, and if you're working through the records, and if you think you're going to get smart and get one of those Amazon things that moves the mouse for you, well, think again, because they're going to look at how long you spend in this record. And if this record is really easy, like it's an appendectomy or something, and you should have been in and out of it, and you're in there for an hour because you decided to go and throw in a load of laundry or go out real quick and run an errand and then come right back, they're going to say, well, why did it take you an hour to code for an appendectomy? That's a fairly simple procedure, and it's fairly quick to get through. So what were you doing? They have ways of finding out if you are fooling around when you are working remotely, okay? So you have to think about that before you get all excited about working remotely. And learning the electronic medical record remotely is no easy feat either, all right? Because what you learned in the school is about the coding side, right? But when you get out in the real world, everybody uses a different electronic medical record. And some facilities are still in hybrid. They still do paper and they do the electronic. So they do a combination of both, which that's a little different for some places, right? So that's the thing. You have to know about the different things in the electronic medical record before you try to set out willy-nilly to work at home right away. Now, does it happen that new coders can work at home right away? Sure, there's a lot of people that do it. I see a lot of HCC, those HCC positions. But you know what happens? When you get in those HCC positions, they're meant to be short-term positions, because if you look at the job listings, you will see, and I've seen it before, where people have said, if your only experience has been HCC, we do not count that as experience. There's some employers out there that are like that. And why are they like that? Because HCC coding is only diagnosis coding. And before you get real excited and think, oh yeah, that's what I want to do, you have to look at your opportunities that you're going to lose out on because you are only coding for diagnosis coding. Because a lot of you will stop coding or stop practicing for those procedures and application of modifiers and evaluation and management. You all will stop. A lot of you will. So that you don't, lose opportunities. You want to make sure that you work somewhere first. And it doesn't have to be forever, guys. It just has to be long enough to get you around the people, because you're going to lose out on a lot of learning if you are not around other medical coders. Because to do this remotely, brand new, and you're having to sit here and they send you your computer, and then you get online and you get it all going and everything, and you think, okay, gosh, I got to learn how to use this electronic medical record. Okay, well, let me call my lead, or let me call my supervisor to ask them because I have a question on this. That lead or that supervisor has other things that they have to be doing, and this is why they don't want new people to be at home, because a lot of times they don't know how to problem solve just yet. And you have to know how to problem solve. And if you have to ask a question, sometimes you may not know how to ask the question when you're brand new, because you may have part of the information, but because you don't have the experience yet, it makes it difficult sometimes to formulate what it is you're trying to say when you're asking a question. So you can't be running back and forth to the people and asking them, oh, well, this, and oh, well, that, and oh, well, this, and oh, well, that, because I'm confused on this, I'm confused on that. That's why, again, they don't want to hire brand new people, because a lot of times y'all don't know how to problem solve. And some of these things are very simple, and some of these things are very easy, these questions, but it's because it's so much that it can be overwhelming at times to people who didn't expect it to be overwhelming. So it's understandable, but at the same time, people have to be ready to come with their A game when they're working at home remotely. It's no easy task, guys. It is not easy. And if somebody tells you that it is, they're lying to your face that if they tell you that it's easy, because it's not. I'm just saying. So the other thing is, sometimes people think that if they work remotely, they can travel. Oh, I want to get in my RV and I want to travel and to connect to Wi-Fi willy-nilly. No, ma'am, no, sir. This is not what this is for, because this is protected health information that you are accessing. Well, guess what? When you are sitting out there connecting to Wi-Fi willy-nilly, now these records are going to be vulnerable. And please don't come at me with, oh, well, that's why they connect to the VPN. There's all these other ways that they're doing this stuff and getting into these records. So no, I'm not listening to that from anybody, all right? Because the thing is, there are laws to protect this private health information that we all have, right? There are laws to protect this information. So if you think that you're going to go willy-nilly and you're going to go out there, I've heard of a woman who wanted to go on vacation in Mexico but didn't want to put in for leave. And she says, well, I work remotely. I'm just going to take my laptop and I'm going to connect to the Wi-Fi. And guess what? When those IT folks, when they log in and they check everything and they say, oh, you know what? This person is connecting to Wi-Fi from this resort hotel. We're going to call them. So they call the lady and they say, well, where are you? Well, I'm at work, I'm at home. No, because this is connected to a resort in Mexico. You need to bring our equipment back. So that's the thing, guys. You can't just be doing whatever you think that you want to do because you want to work remotely. And yes, sometimes people want to work remotely because, Blue, I live out in the rural area and I'm kind of far, and that's understandable. And there are people who do it. There are people who finally find their jobs, right? Never worked around other coders before, and they do find their jobs working remotely, and they have been successful. But I guarantee you there's part of their growth process that's probably missing as a brand new coder, because they didn't get that time around other coders. They didn't get that time around their providers, right? And sometimes, yes, I know it's one person that does the queries for the providers and spends the time with the providers, and the other coders just do production coding. But again, that's not the way that it should be when you're brand new. At least that's just my opinion anyway. But again, if you want to work remotely, just know, and you're brand new, just know that it's not easy. That's why they want people to have experience. They want people to know what they're doing, because that's going to take out part of that problem when they are working at home. Is, okay, this person has experience. They know how to problem solve. They know how to use the electronic medical record, because once you learn one, it's kind of easy to figure out the rest of them. Some of them are a little bit more complex than others, obviously, but you kind of get the general idea when you are working with the electronic medical record. So that's just what I want to say. And, for those of you who say, well, I still want to do this and I still want to do that, and I want to do medical coding as a side hustle, I'm going to do that in a separate video. Medical coding is not a side hustle, period. It's not. And for those of you who are trying to treat it like it is, shame on you. Why? Because this is not something that is going to be one of those quick and easy things like you see on TikTok, or you see in Instagram, or whatever, those reels and things like that, where they say, oh yeah, you can do this in your part-time, and you can do this in your... No, especially when you're brand new. Now, when you have experience and you want to work part-time, that's when that's okay, because you have experience then. And an employer is not going to have to sit here and train somebody who's only going to be working part-time and who's brand new, and they're only going to maybe get a quarter of the production out of them. They're not going to do it. People who have experience, yes. Now, again, I don't know every employer in the world. So, and if you know somebody who hires brand new coders part-time, well, then good for you. But that's not the majority of the time, okay? That's just what I'm saying, all right? So that I want you all to know. And the thing is, it's just better for you to be more prepared. And a lot of you talk about wanting to be prepared when you go into coding. But you want to insist on working remotely. And I'm telling you now, that is not a good idea. Because when you work remotely brand new, and you come across a record that you have no idea how to code it, or it just never made sense to you, and then you go and you ask your lead or your supervisor for help, they may not be able to help you right away. Well, guess what happens to your productivity? Down it goes, because you can't figure one of these out. When it would be better if you were in person, so that way you can get to know the whole process. You can really be prepared for working at home remotely. And as I said, it doesn't have to be forever. It could be for 3 months. You could go to a temporary agency, not one of these staffing agencies that you see on LinkedIn, okay? I'm talking about a legitimate staffing, a temporary agency in your area, and you can Google temporary agencies for medical professionals. There is not a national brand that I know, but temporary agencies for medical professionals. And when you do that, all the temporary agencies will come up. And sometimes they have contracts for the local hospital or local doctor's offices that they need people to come in and fill in. And somebody's going out on an extended leave, or they're having a surgery or whatever, so we need somebody to come in and fill in. It's not going to be little one-day assignments, okay? So I think that's what a lot of you think that it is. It always is one of the one-day assignments. It's not like that. When I call out sick, or when I go on leave, my work is waiting there for me. But it's when people are like on extended leave, or they're trying to scout out through the temp agency for a coder, because they're going to rely on the temp agency to make sure that the person is competent. So you will be tested on your knowledge when you go. And so then when you are working with them, then you can find out all of these things. that you will have somebody to be around you so that you can ask these questions, because there's going to be a lot of things that are not in the book that you're going to learn in the real world. All right. And it's so much easier when you're around others than to, be alone by yourself. All right. It's not all it's cracked up to be. For you all who are romanticizing working at home and you've never done it, I'm telling you now, it's not the easiest thing in the world. And it is very isolating. It can get lonely. It can get very boring. All right. And you may think, well, it'll be a dream come true because I don't want to work around people. You get just as much drama remotely as you would if you were in person. The only thing that makes a difference is that people remotely that are working, they're a lot more braver because they don't have to be around you. And they're going to say whatever it is they want to say, because what are you going to do about it? Right? And so that's the thing. You want to make sure that if you are going to take this seriously, if you are wanting this to be your career, that you treat it very seriously and not get all wrapped up into these things like these schools are trying to sell. Oh yeah, you can work remotely just to be at home and you can do all these things, and you can be taking care of your kids. If your kids are very distracting or if they demand a lot of your attention, this is probably not the career field for you, because this is going to take you time to concentrate on. When you have to sit here and look at these medical records and these encounters that are written differently by many of the providers, they all have different ways of expressing themselves. Some of them use abbreviations out of control, so you have to make sure that you query them to clarify what it is that they're trying to say. There are some that they have very detailed messages, but the more detailed, the longer, and the more you're going to have to read. And then there are some that you're looking and you think, oh yeah, I have everything I need, and then it's missing a laterality, or it's missing a modifier. It's missing something. And you have to be the one who's actively looking at these things. It is a puzzle, but it's not as nice and clean as what's in those workbooks, right? The workbooks will help you, certainly, but it's not going to be as clean when you're working with those electronic medical records, all right? So that's just something that you all ought to know. And again, stop romanticizing working remotely immediately. There is not every single job that can be worked remotely. There are other things that you can do remotely that will be much easier and much less expensive to maintain as well. So if that's of interest to you and this is too much for you, then you may want to reconsider, because we have to know what doctors know while never having gone to medical school. And please don't write me and tell me that just scared you, because guys, that's the reality of what we do as medical coders. We pay attention to the new regulations that come out, the new guidelines that come out. The codes get updated every single year. There's new codes added. There's codes deleted. There's a lot of things that we have to be able to maintain. And to be able to do this, it takes a lot. It's not easy, but it is a wonderful career. But it's just that I'm letting you all know that for those of you who immediately want to do this remotely, it's just not a good idea for brand new people. Do it if you want to. Don't take my advice if you don't want to. It's your choice. You have a choice. But I want you all to be set up for success. And that is the one thing that I will always continue to say. No one will ever stop me from saying that, which is I want y'all to be set up for success. And there are some things that you may not want to hear that I say. And there may be things that you want to do. But again, there's a time and a place for it. And there's a time where you're going to be able to earn those things. You're going to be able to earn the ability to be able to work at home remotely. I could work at home remotely right now if I wanted to. I don't, because to me, it's just so much better when I'm around my providers. But that's me, all right? And like I said, I'm not like in the rural area. And for some people, that would work better. And that makes sense to me. But don't be so stubborn in the beginning. Get your experience from someplace. Even if it's 3 months worth of experience, you will be better equipped to handle working at home remotely than you would if you're just starting brand new. And then you're going to get all these brand new things. I'm just saying. So with that said, I'm going to wrap this one up. Thank you guys so much for joining me. If this video helped you, please like, subscribe, and share. And I'll see y'all next time. Bye.